This year, we reviewed 7 tax preferences as part of our annual review cycle. The Citizens Commission for the Performance of Tax Preferences selects the preferences our staff reviews each year. Hi, I'm Stephanie Hoffman.
And I'm Susanna Pratt. We're staff to JLARC, and today we'll summarize the results of these 7 tax reviews. The preferences we reviewed covered a range of industries, including health insurance, manufacturing, and medical cannabis. The legislative auditor recommends action on 4 of the preferences. We reviewed a preference that reduces the health benefit exchange's administrative costs by $1 million per year. This allows the exchange to maximize its funding for operating a health insurance marketplace. The legislative auditor recommends that the legislature extend the 2023 expiration date or make the preference permanent.
For a tax deferral program for manufacturing, we found that businesses using the preference met legislative job goals, but likely would have built their facilities without the tax deferral. To increase manufacturing jobs or training, the legislature should consider modifying the program.
A preference for printing and publishing newspapers provides relief to the newspaper businesses and saves them money, but the industry continues to lose jobs and revenue. The legislature should review this preference to determine if it provides enough relief for newspapers and whether more assistance is needed.
We reviewed 7 preferences that provide tax relief to medical cannabis patients and cooperatives. After statutory changes in 2019, it's unclear how pending taxpayer guidance may affect beneficiary savings. The legislature should continue the preferences, and the Department of Revenue and the Department of Health should update their guidance.
The legislature already implemented a recommendation for one preference during the 2021 session. JLARC staff reviewed an exemption for targeted urban areas and reported that cities may have been ineligible to offer the preference. The 2021 legislature implemented the recommendation by amending the preference's population criteria and extending its expiration date.
Finally, the legislative auditor recommends allowing one preference to expire and clarifying the intent of another. A tax credit program for renewable energy increased the state's solar capacity and met its employment target, but it did not increase low-income participation. Solar installations continued after the program reached its funding limit. The legislature should allow the preference to expire since it has completed the majority of its goals and installations still continued.
We reviewed a property tax exemption for nonprofit outpatient dialysis facilities. These facilities outperform for-profit facilities on 2 measures. However, a previously inferred objective of encouraging charity care does not appear to be relevant for kidney dialysis, and consequently, the legislature should clarify the intent of this preference.
For more information, check out our tax preference reviews on our website.